Thank you very much. Next slide, please. Next slide. So there are quite a number of samples that can be tested in the laboratory. There are lots of them. But the top examples include we have urine, we have blood, stool, sputum, aspirates, swabs, CSF, known as the cerebrospinal fluid, skin, and semen. So these are some of the top examples of specimens or samples that can be tested in the laboratory to detect the presence or absence of microorganisms. Now these microorganisms, they can either be parasites, they can be fungi, they can be viruses, or even bacteria. Next slide, please. Okay, don't worry, I will explain it in the other slide. Next slide. Okay, so this is a diagram showing some examples of samples that can be tested in the laboratory. Now this is a nasal swab, that's your swab stick. And why they call it nasal swab is because this swab sample was collected from the nose. Now you can have, okay, see another one, a vaginal swab collected from the vagina. For example, your HBS test to be collected from the vagina, from the walls of the vagina. This is another type of sample. Now we also have blood. We all know blood. We know urine, semen from men to check for infertility. Then stool to also check for parasites. We cannot even use stool to even test if a patient has typhoid, checking for salmonella typhi inside the stool. Then we also have pleural fluid. We have vaginal swab. We have sweat. You can also check for parasites from sweat. Sweat is also another type of sample, though it is rare. But in some big hospitals, you see the doctor or the lab scientist asking for sweat as a sample. Then tissue blocks. This is connected or associated with the branch of medical laboratory science known as histopathology that deals with the study of tissues. Now they have to collect either from collect samples from the skin, or even when a patient goes for appendectomy, like the removal of the appendix. When it's done, the scientist or the doctor, they will take it from the theater down to the histopathology laboratory inside a fixative called formalin. Then when they get there, they will have to test it for the presence or absence of microorganisms or even cancer, as the case may be. Next slide, please. Sample collection. Now this is a diagram showing a scientist or a phlebotomist. A phlebotomist is a person who collects samples. Now this is a diagram showing the process of phlebotomy, blood collection procedure. Next slide, please. Let me explain further. So now, if you are asked what sample collection is, for example, your doctor asks you, nurse, please go and collect that sample. And you are now asked, please, what is sample collection? Now, sample collection is a process to collect a sample. Like sample collection is actually a process by which bodily substances like blood or urine, their fluids, are being obtained from humans or animals. That means samples can also be collected from animals too, and also humans, for use in a chemical analysis. Now we are collecting that sample just for us to check or run analytical tests on them for the determination of the presence or absence of microorganisms. So this is the purpose of why we collect samples. So sample collection is a process. Is that process by which you obtain that sample from either humans or animals. Why? To test for the presence or absence of microorganisms. Next slide, please. Methods of sample collection. Next slide, please. Now, these are quite a number of samples that we test in the lab, and I'm going to explain to you how the samples are collected, what we normally use to collect the sample, and also the procedures if need be. Next slide, please. Now, firstly, we talk on blood. If you are asked what blood is a bodily fluid and also a tissue at the same time. Why is it a tissue? Because it comprises of cells put together, red blood cells, white blood cells, and platelets. So blood is a bodily fluid and also a tissue that carries necessary substances such as nutrients and oxygen to the cells in your body, and also help remove metabolic waste products from stem cells. It takes oxygen to cells that needs it, and also help remove carbon dioxide, which is a metabolic waste product from stem cells. And this blood is being pumped by the heart. And this blood contains some parasites, some microorganisms that give information in the diagnosis of diseases. Now there are two methods by which this blood can be collected. Though there are three, but we are majorly concerned about these two procedures, which is the venipuncture sampling and the finger stick sampling. Now, like the word venipuncture implies, it means a process by which blood is being collected from the vein, like puncturing a vein for the purpose of collecting a blood sample. Now, this venipuncture sampling, this venipuncture sampling is majorly one of the methods by which blood is being collected in the laboratory, and it's very, 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 very important, or it's very important and of advantage because of cases where you have to carry out more than one blood test. Are you getting? So now the process of collecting blood from the vein, from the median cubital fossa or the median cubital vein, that's this place, is what we call venipuncture sampling. Now to collect this sample, you have to tie the tourniquet around about 2 cm above, because in medical laboratory, unlike the nurses that do call this vein emergency vein, we don't call it emergency vein. This is the major vein we collect blood from in medical laboratory profession. We don't collect blood from here. It's only in a case where the vein is not found or seen in the median cubital fossa. They have to go to other places like the back of the palm and all that. So the tourniquet is to be tied 2 cm above the site of puncture, and after which, and that tourniquet you are tying, you want to tie it in a way as it will not be hard for you to loosen it after you must have collected the blood. You tie it 2 cm above the site of blood collection, then you take your wet swab and swab just to clean the area, to disinfect the area, after which you layer your needle into the vein and collect the blood. After you are done collecting the blood, you have to loosen the tourniquet and then place your dry swab and ask the patient to open the hand after the patient must have made a fist before you collect the blood. Then you have, and after that, you layer it into your sample bottle, depending on the test to be carried out. You get them? I will say more. Now, okay, all I done with this for test sampling. Now, the other one of this sampling. This is a process where that blood is being obtained from the capillary. From your capillary, for example, your thumb or the back of the toe, or from the earlobe. And we normally use this capillary tube to collect the sample. This finger sampling is the kind of sample that we normally use for PCV in cases where for example, for children, where the vein is not seen and you cannot collect it into a container and start using normal capillary tube. You have to use your heparinized capillary tube and collect it just directly from either from the thumb, the back of the toe, or from the earlobe. But one disadvantage of this finger stick sampling is that it does not allow for multiple tests, because the sample is a little sample. You cannot use it for more than one test apart from your PCV. Are you getting? So that's all for blood. Now the other one is urine. Urine is a water-soluble waste product that is being excreted from the body by the kidney. And this urine contains some chemical substances and also some cellular components that gives information in the diagnosis of disease. And there are quite a number of types of urine, depending on how or where the sample is being collected from. Now we have 24 hours urine. The urine that you collect from a patient. For example, the patient comes in by 8 a.m. you give the patient a container and ask the person to pass out all subsequent urine from that time till tomorrow, that same time. For example, the patient comes 8 a.m. today, you tell the patient to pass out all the urine from that day till the next day up to the time the patient came in, like 8 a.m. till 8 a.m. the next day, 24 hours urine to check for kidney problem. Then also we also have the midstream urine collected from the mid portion of the urine. Like the patient is asked to pass out the first part of the urine, then pass out the middle part inside the urine passer container, and then pass out the other one to the toilet. You understand? So then we also have our early morning urine. Early morning urine is the best urine to be used for any urine analysis. Why? Because it is more concentrated and it gives the medical laboratory scientist or technician best of the information we need for the diagnosis of disease as the case may be. Then we also have our catheter urine for patients that cannot pass out urine by themselves. For example, you fix a catheter bag for the patient to pass out urine. There's no way you can tell the patient to start passing out urine. Why? Because the catheter is there. So you have to just open the bag and pour the urine inside the universal container and take it to the laboratory. That's the catheter urine. Then we also have the suprapubic urine for patients that cannot pass out urine. So this one, you just have to break your needle and prick the patient directly. You swab the area, the bladder, then from the outside you prick the patient and you see the urine start gushing out and you collect the sample inside the universal container. Now this urine, we use it for tests like urine microscopic culture and sensitivity. We also run tests using urine called urine analysis, that's urinalysis, using the dipstick method to check for the state or pattern of the human system, because urinalysis gives a general picture of how the human system is, if there is any abnormality in the kidney or urinary tract. Now this urine is to be collected into a wide-mouthed, leak-proof, dry, sterile container and brought to the laboratory. Now we also have stool. Stool is to be collected also into a wide-mouthed, leak-proof, dry and sterile container. And the patient should be told not to go and bring all the stool. Like for example, the patient pass, let me say, 7 grams of stool. The patient should not fill the other container with the stool, thinking that because some patient they will feel that now as it take many, then they will take something inside. Tell them to just take a little portion of the stool that they should have passed out into the container. Now we also have sputum. We use sputum in the laboratory to also test for the presence of parasites, because there are some parasites or bacteria that can be found in the sputum. And the patient should also be told not to bring saliva, because the results they are producing is as good as the sample itself. The patient should be told to, because sputum is normally collected early in the morning when the patient has not eaten, brushed or even drank water. The patient is asked to create a deep cup and dispense it into the sample bottle, the wide-mouthed, dry, leak-proof container. We normally use this sputum to check for AAFB, known as the acid and alcohol fast bacilli, which is the Mycobacterium leprae or Mycobacterium tuberculosis, which causes what? Tuberculosis. That is one of the bacteria that we can find in sputum. We also find other parasites like Parabolimus westermani. That one is advanced. So then the other one is aspirates. Aspirate, they are fluids that are collected from an enlarged part of the body. For example, this fly that causes human African trypanosomiasis, which is known as sleeping sickness. When the fly comes to take a blood drain, it creates, after taking a blood drain, it creates a little form of hard and painful needle called a chancre. And any fluid collected from that part is called what? An aspirate. So an aspirate are those fluids collected from any enlarged part of the body. And we can also find parasites inside, like your trypanosomes that causes sleeping sickness. Then swabs, okay, we all know this one. Swab samples, depending on where the sample is being collected from. If you use a swab to collect the sample from the walls of the vagina, it's called eye vaginal swab. Then if you use this one to collect sample from a wound, it's called a wound swab. We have throat swab, we have nasal swabs, and all kinds of swabs. And we use these swab samples to check for the presence or absence of microorganisms. For example, organisms that causes infection, like your Candida albicans that causes candidiasis. Now we also have CSF, known as the cerebrospinal fluid, collected from the vertebrae column. This sample is collected by the doctor himself only. Even the scientists cannot collect the sample. And these samples, when they come into the lab, when they come into the hospital or the laboratory, they need to be treated with care. Because if you see where this sample is being collected, you will even pity for the patients. And most times these samples are usually collected, or they are minimal in volume. So you have to treat them with what? With caution. Now we also have skin. These skin sample, we use them for in pathology laboratory to check for the presence of parasites like mites that causes scabies. Now to collect this sample, the patient needs to, like, you clean a particular area or part of the skin, then use your lancet to pick the skin and use your surgical blade to cut the skin. So cut a very deep portion and make sure that blood does not touch, like blood does not follow the skin. After which you place it on a clean grease-free slide with a drop of normal saline. Then you put it in an incubator for about 6 hours before checking or viewing it under the microscope for the presence or absence of what? Of microorganisms. Now semen is the last one. Semen, we use it for semen analysis to check for infertility problems. Now this semen, the patient is asked to abstain for 4 days, and after the doctor will tell the patient how or the procedure in which semen is proceeded at the transportation of the coitus interruptus. Next slide. Sample handling. Next slide. Sample handling, this term describes the ways in which samples are being transported and handled, both on the way to the laboratory as well as during the processing. Now this sample handling is very important. Be cautious of. Why? Because your sample collection procedure might be good and okay, but the way in which you transport the sample to the laboratory might actually affect the results or the analytical procedure that sample will go through. Next slide, let me explain this. Okay, so for example, you collect a blood sample because we have lots and lots of sample containers. This is your EDTA. It contains the reason why they call it EDTA container is because it contains EDTA. And EDTA means ethylene diamine tetraacetic acid. This EDTA prevents blood from clotting. It contains an anticoagulant. An anticoagulant is a chemical substance that prevents blood from clotting by removing or chelating calcium, because your blood contains calcium. So by the time you withdraw it, that's why when you withdraw blood into syringe and you leave it for a longer time, or leave it for like an hour or even 30 minutes, and it will clot. So that's the reason why we normally put it inside EDTA. Why? Because it contains an anticoagulant. Now this is a plain bottle. If you want to run serum calcium test, for example, you need to use this plain container. So this is called a plain container. Why? Because it does not contain any form of anticoagulant that prevents blood from clotting. So when you put your blood inside this, because this container contains 0.04 ml of EDTA. So 2.5 ml of blood. Now by the time you layer it, for example, let me say this water inside there is blood. You don't shake to mix the blood with the anticoagulant. You don't shake because what? Hemolysis. Hemolysis is the process that which is the rupture or destruction of red blood cells. And as long as the blood has been hemolyzed, it will lead to false positive results or false negative results. So by the time you layer blood into an EDTA, if it's plain container, no need for you to shake. There's no, because it does not contain anything. But if it's all this kind of because we have lots and lots, different types of anticoagulants. This one is fluoride oxalate. It is an anticoagulant. This one is EDTA, and this one is lithium heparin. So by the time you layer your blood inside this EDTA container, you don't shake like this to mix. You mix by gentle inversion, because the blood is very fragile. By the time you start shaking, it will rupture and destroy. Are you getting it? So by the time you layer it inside your container, you mix by gentle inversion, or you mix like this carefully, because your sample collection procedure, you collected your sample well, then they will now start saying our laboratory has given wrong result, not knowing that it's the way you handle the sample. You start shaking blood as if you start agitating the blood as if you want to speed up the classification. So please, by the time you layer blood inside your sample container EDTA, you don't shake, you mix by gentle inversion. So now this is an EDTA that prevents chelates calcium. This EDTA is a multi-purpose anticoagulant normally used for majority type of cell tests like your ESR, erythrocyte segmentation rate, PCV, NP, etc., or all serological tests. Then this is your lithium heparin, normally used for chemistry tests like your EUCRO, electrolyte, urea, and creatinine. The heparin in this container prevents the blood from clotting, while the lithium in it forms a complex that does not interfere with electrolytes, because now you are actually testing for electrolytes, urea and creatinine. Now that electrolyte contains bicarbonate, calcium, chloride and phosphate. So by the time you put the blood for PUC inside this container that chelates calcium, that removes calcium, you will not get an accurate result. Why? Because it has already removed calcium. You will not start seeing calcium. Maybe the calcium level is supposed to be 30 and now we are not seeing 20. For me to do that is a false positive result. Why? Because the sample was collected into an EDTA container which actually chelates calcium. Now this is also known, this anticoagulant is known as your fluoride oxalate, normally used for sugar tests, because the fluoride in this container inhibits glycolysis, which is the breakdown of glycogen into glucose. Are you getting? Next slide, please. Sample preservation and storage. Now, after you must have collected your sample, you need to preserve them before storing them. The preservation comes before storage. So all samples with the exception of your swab samples are to be stored in the refrigerator. Now let me explain this. Please, for your urine, depending on the kind of test to be carried out. If you want to run urinalysis, for example, you don't need to put any form of preservative. We have lots and lots of preservative. Even your anticoagulant is a preservative. You also have boric acid that they normally put inside your urinalysis bottle to prevent the deterioration or further replication of the organism inside that urine. So please, if you want to run urinalysis, you don't need to put any form of preservative inside after collecting it, and the test is not to be run or processed immediately. Just to put it inside the fridge, leave it there. Nothing will happen to it. But if you want to do urine MCS, microscopic culture and sensitivity, and you know that there is going to be a delay in the processing, you have to ask the laboratory to give you boric acid. Boric acid is one of the preservatives that is to preserve urine. So all forms of samples, except with the exception of your swab samples, because the kind of organism we find in swabs cannot withstand your refrigerator, the temperature of your refrigerator. They will actually die off. When you not test them, you will not see anything. That's the reason why when you collect any swab samples, you have to inform the laboratory immediately, because all swab samples need to be processed immediately, as soon as possible, if possible. So these swab samples are not to be stored in the refrigerator. But by the time you collect blood, urine, or any other kind of sample, you can store them in the refrigerator. Next slide, please. Okay. So let me use this container is showing a container sample collector containing blood. So by the time you collect blood into your sample container like this, you don't have to put it inside the fridge. And this other one is showing a tissue like maybe your skin tissue, skin, or even the liver, any kind of organ or tissue that is being harvested in the theater. For example, maybe a female has cancer of the female reproductive organ, and the doctor has to, or the surgeon has to uproot or remove all the female reproductive organ, everything. By the time they are done with it, like I said just now, they put it inside the freezing tube. For example, if they should bring that sample into this laboratory, you will have to ask them for a physics known as formalin that will keep the tissue as lifelike as possible. Because once a tissue has been removed from the normal source, like in the body, it will start deteriorating. And there is no way you can test that sample if the tissue or the organ has started deteriorating or decaying. That's the reason why you have to tell them to put inside a physics, or you call it formalin. Now this is another kind of form of sample preservation. This one, you just like your SCs, you just make a smell, then you air dry. After you air dry, you stain with any stain that is made available. You air dry again, and you store it in your slide container. It can be there for 2 years, 3 years, nothing will happen to it. So that's another way of storing your sample. Now this is a swab sample. Please and please, like I said just now, do not store your swab samples in the refrigerator. do not store them in, just inform the laboratory to run the test immediately as soon as possible if possible. If they stool sample, like I said just now, you don't need to tell the patient to you need to tell the patient not to fill the container to the brim. Are you getting? Just collect small and put it in the sample container, not the one that they go and press all the people that they release that one, they press it, they will say is here. In many cases also inside, just need to just bring a little portion. Then this you bring inside the refrigerator, this sweat. Then these are other sample containers that you can actually use to store your sample. Next slide is okay. In conclusion, one of the goals of the laboratory is to produce reliable, relevant, and rapid results. Reliable, rapid, and relevant results. Reliable in the sense that if I should run PCV here in this laboratory for a patient or for myself and I had 36% as a PCV, if I should take that same sample to another laboratory, they should also get same result plus or minus 1. So that is one of the laboratories goals, to produce reliable results. Then rapid results in the sense that you don't need to spend 2 hours running serological tests, doing hepatitis B tests using your serum or your plasma. It should be rapid but at the right time. For example, you want to run MP, the patient start worrying you, what you do 1 hour don't pass. See, on a norm, the stain normally used for MP, we stain for about 30 minutes depending on the stain and the dilution. If you should dilute your ginger stain, the one we use to stain MP, 1 in 10 dilution, you stain for 30 minutes. And before you even start staining, you have to make your smear light to dry because we don't have what plates here. So you have to make it for this air to touch it so that the thing will dry. Before you will not stain for 30 minutes, before you will not rinse, before you will not carry out microscopy, it's over 1 hour. So even if your test should be rapid, but it should be rapid at the right time, not because that because the patient is pressuring you, you will not go and stay for 10 minutes, you will not see anything, you just want to give false positive results. Then also it should be relevant in the sense that it should contribute to the well-being of the patient. At least your results should still understand. You should produce a reliable result that will help in the betterment of the patient. Also, it is known that a test result is as good as the sample itself. This is trying to say that, for example, I want to check for tuberculosis in sputum. The patient is bringing saliva. I will not run test and I will not see tuberculosis inside. Why? Because the sample that was brought is not what I am looking for. So the test result, as long if your test result is to be reliable and relevant, or even relevant and reliable to the patient, or even to the hospital itself or the doctor himself, your sample need to be also good and relevant too. Because if, for example, that sputum, you tell the patient to go and bring sputum to create a deep cough and dispense inside the container, then the patient went ahead to bring saliva, you will not see anything inside. So a test result is as good as the sample itself. So please and please, all these from the analytical from the pre-analytical stage down to the post-analytical stage, that is where you have to give us results. The only way we can produce good results or relevant or reliable results is if your sample collection procedure are done in the proper manner or method. So please, when you collect blood sample, don't shake, it will hemolyze the blood. When you collect blood or urine and it's not to be run at that particular time, store them in the refrigerator. Do not leave them on the bench waiting for the scientist or the laboratory technician. And lastly, samples should be treated as gold and handled as a biological hazard that could save life. That sample should be handled or treated as gold. Like that CSF I was talking about, that it takes maybe it's contained in the laboratory and you get to find that the CSF is just small like this, and you and you start treating it anyhow, you just throw it. For example, now the sample now, because if you see where they are collecting CSF, you will put it from the patient because it's very, very painful. You have to screw the needle through the vertebrae column and collect the sample. And most times those samples they come in a minimal amount. So please let samples be treated as gold. Why? Because they can actually save lives. Then lastly, please, all samples that comes into the laboratory or that you collect from a patient are to be treated pathogenic. That is, they can actually infect you, except being proven otherwise. Even after proving otherwise, even after they test the patient and you find out that the patient is hepatitis B negative, that sample needs to be seen as hazardous or pathogenic. Are you getting me? So please, when handling samples, wear your gloves, or after handling your samples, wash your hands. Because microorganisms are ubiquitous, they are everywhere. And these microorganisms, they can either be pathogenic or non pathogenic. The majority of them are what? Are pathogenic. So this is where I cut. This is where I close the cutting. Thank you for listening. Any
We are finished. How many of you are expecting this young lady before now? How many of you? I'm not expecting this young lady before now. Nobody. If I hear anybody